Good afternoon, everyone. Thank you for joining us today. I am joined, as you can see, by Jason. He and I will take questions shortly. Before that, though, I'll give an update on where we stand with COVID right now, starting with today's statistics. We are reporting another very sharp rise in cases today. 6,835 positive cases were reported yesterday. That is by far the highest number in a single day so far, and it represents 14.2% of all tests carried out. However, I should also say, for some context, that there was also a record number of tests carried out yesterday. That doesn't entirely explain and account for the rise, but it does give, I think, some important context. 479 people are in hospital currently. That is 53 more than yesterday, and 47 people are in intensive care, which is the same as yesterday. Sadly, a further 4 deaths have been reported in the past 24 hours, and that takes the total number of deaths registered under this daily definition to 8,103. And as always, my condolences go to everyone who has lost a loved one. As of this morning, 4,095,463 people have now received a first dose of vaccine, and 3,629,482 have received a second dose. The vast majority of people over the age of 40, now 95% of them, have had two doses of the vaccine, so are now fully vaccinated. 70% of 30 to 39-year-olds have also now had both doses. For the 18 to 29-year-old age group, 74% have had first doses, and so far 46% have had second doses, although second doses are, of course, ongoing in that age group. And I can tell you that in 16 and 17-year-olds, where the beginning of vaccination is much more recent, almost half, 44%, have now had their first jab. So these rates of vaccination are positive and continue to give us, even in the face of case numbers such as those I've reported today, optimism for the remainder of our pass through this pandemic. We know that if we're fully vaccinated, we are somewhat less likely to get COVID. Although, as I said on Tuesday, around a third of new cases at the moment are of people who have been vaccinated. However, even more importantly, we know that being fully vaccinated makes us significantly less likely to fall seriously ill from COVID. That's why the high number of new cases that we are seeing just now hasn't so far led to the same number of hospitalisations that we saw in previous waves of the pandemic. That said, the case numbers that we are seeing at the moment are still a cause for concern. In the past 7 days, we've reported more new cases than at any previous time in the pandemic, although I refer back to my point there about higher levels of testing. But case numbers have roughly doubled over the course of the past 7 days. It's important to point out that case numbers are rising across the UK just now, but after a period of slower increases in Scotland, the rise here is particularly sharp at the moment. That is possibly, at least in part, a reflection of the fact that our schools return earlier with the increased interactions that come with that. And although vaccination has significantly weakened the link between a high volume of new cases and serious harm to health, it hasn't completely broken that link. So even if a much smaller proportion of people who get COVID now need to go to hospital, which is the case, thankfully, basic arithmetic tells us that a small percentage of a large number is still going to be a significant number of people. And indeed, in recent days, we have seen an increase in the number of people in hospital. To give some context to that, last Friday, 312 people were in hospital with COVID. Today, as I've just reported, that figure is 479. And of course, people who don't go to hospital can still suffer serious illness, including long COVID. So the potential health impact on individuals is a concern in itself, but that also will put our health service under further pressure at a time when many staff have been working flat out for 18 months and when we're trying to catch up with a backlog of other procedures. If you recall, at the start of the pandemic and throughout much of last year, protect the NHS was one of our key messages, and it's still something that we need to bear in mind at this stage. So all of this is why on Tuesday, when I last stood here, I described our current situation as fragile. There's no doubt that the vaccines are allowing us to take a far less restrictive approach to dealing with the virus than we did in earlier stages. And we know, of course, that the measures which have been in place for much of the last 17 months have in themselves caused serious harm. They've disrupted schools, hurt the economy, affected well-being. That's why, even although if we are being responsible, which we must be, we can't and shouldn't rule anything out in the face of a pandemic, none of us want to go backwards to even limited restrictions. Of course, we can't ignore the current surge in cases either. My job in times like these is not to be popular, it's to take any decisions, no matter how difficult, that are necessary to keep us safe, and I will certainly not hesitate to do that. In particular, we are currently watching closely to see whether and to what extent we might start to see significant increase in serious illness and obviously in people being hospitalised. So I will continue to keep you updated in the days ahead, but it's worth being clear right now with you that some of the speculation you might be reading in the media is not accurate. For example, we are not currently considering a circuit breaker lockdown. For the moment, though, I do need to stress the vital importance of everyone playing their part in limiting the spread of the virus. The more we all do this, the more chance we have of avoiding the need for the reimposition of any formal restrictions. So, for example, we're asking businesses to ensure that they continue to encourage workers and customers to comply fully with COVID mitigations. That includes wearing face coverings in indoor spaces where required. Businesses should also at present continue to work with staff to support home working where at all possible. It is, of course, vital for businesses, as it is for everyone, that we do slow the spread and avoid the need for further restrictions. And I'm grateful to businesses across the country who I know are doing so much to help us achieve this. In addition, of course, all of us as individuals have a really important part to play. We all have some control over transmission. So there are 3 steps in particular that we must all take to keep the virus or get the virus under control and slow down transmission. So I want to close by emphasising again what those are and taking the opportunity to remind people afresh of how important it is that we all abide by all of these mitigations. Firstly, if you are eligible and if you haven't done so already, please get vaccinated. I can't stress enough that this is the single most important thing any of us can do to try to keep each other safe. But as I said on Tuesday, the counter to that is every person who opts not to get vaccinated is putting themselves and others at greater risk, and of course is reducing the overall level of population immunity that we might otherwise achieve. There are drop-in vaccination centres in every mainland health board area. You can go to NHS Inform to find out where the one nearest to you is, or you can follow your health board on social media. If you haven't been vaccinated yet, if you've had your first dose 8 weeks or more ago, just turn up at the nearest centre and you will be given the vaccine. If you have doubts about vaccination, go along to a centre anyway, would be my request. The staff, volunteers there will be able to answer any questions that you have and talk you through the process. Second, please test yourself regularly. If you do that, then if you have the virus but you're not displaying symptoms, you have a chance of finding that out before you go out to work or to socialise. So testing yourself regularly makes it less likely that you inadvertently pass the virus on to others. So it is a really important mitigation that we're asking everybody to observe. Again, just to remind you, you can get lateral flow tests free through NHS Inform. You can have them sent to you in the post. You can also pick them up at test centres or local pharmacies. Remember, if you test positive through one of these devices, or if you have symptoms of the virus, make sure you self-isolate and you get a PCR test. Self-isolation remains an important way that we can all slow down the spread of the virus. And thirdly and finally, please continue to follow the rules that are still in place, limited though they are at this stage, and continue to follow all of the public health guidance. That's important for all of us. Even basic steps, wearing face coverings on public transport, for example, opening a window if you've got someone in your house to make sure there is good ventilation. All of these things make a big difference. So please remember, it is still a legal requirement to wear face coverings in certain indoor public places, shops, public transport, and when entering and moving about hospitality settings. It's a simple but really important way in which we can all help protect each other. And more generally, it's important in these current circumstances that all of us think about how often we're interacting with others and with how many others we're interacting with, to think about the risk that we are running when we go out and about, and the basic steps we can all take to slow down and avoid either getting the virus from somebody else or passing it to somebody else. Again, we should all remember, wherever we are right now, that the virus is likely to be somewhere there with you. So meet outdoors as much as possible. It's not risk-free, but we know it is lower risk than being indoors. If you are indoors, try to avoid places that are crowded. And as I said a moment ago, open the windows. The more ventilated a space is, the safer it will be. Even though it's not the law anymore, try to keep a safe distance from people in other households if you can, especially when you're indoors, and continue to minimise direct physical contact where possible, handshaking, for example. And remember to wash your hands and surfaces regularly and thoroughly. All of these things that have been important all along remain important now. In some ways, as legal restrictions on our lives have been lifted, these basic measures become more important. And with the virus transmitting as much as it is right now, it is really important that we all take steps to remind ourselves to do all of these things. If we do, we will help limit spread. We'll make ourselves safer, we'll make our loved ones safer, and we will help make sure that we maintain progress forwards and not have to impose any further restrictions. So please get vaccinated, make sure you test regularly, and please tighten up again on following all of the basic mitigations and health advice. Thank you for listening, and we're now going to move to questions when Jason will join me in answering these, and I'll go firstly to Ewan Petrie from STV.
Thank you, First Minister. Given the steep rise in case numbers we've seen again today and in the past week or so, when do you think we reach the tipping point where restrictions will have to be brought back in, or have we officially now reached the stage where that is no longer the key indicator and it's more about hospitalizations, as we've seen in Germany? And for Professor Leach, if I may, we're seeing a number of big events taking place this weekend, from the Old Firm to a music festival here in Edinburgh. Again, given the case numbers, is it safe for these events to go ahead, in your opinion?
I'll hand over to Jason very, very briefly. I mean, I understand, absolutely understand the question of, what's the point in time that you would make a decision to move from where we are just now to restrictions. It is not that binary. We monitor this on an ongoing basis. I had a session yesterday afternoon with senior advisors looking at the current situation in a lot of detail, considering what steps might or might not be appropriate, and that will be proceeding right now at government level on a literally a daily basis. In terms of the change in how much we look at case numbers versus numbers of people in hospital, the health harms of cases, that has been changing, and you've heard me talk about that before, because of vaccination breaking the link between the numbers of people getting COVID and the numbers of people becoming seriously unwell. We don't ignore case numbers completely because of long COVID and other aspects there. So we're not going to completely ignore case numbers, but we do look now more at the harm indicators. So how many people are being admitted to hospital? How long are they staying in hospital? How many people are going from hospital admission to ICU admission? Now, thankfully, all of these things, on the basis of the case numbers we have right now, are at a much lower level than they would have been at these case number levels earlier in the pandemic before vaccination. So that's positive. But of course, our health service is trying to get back to normal, unlike last year when it was effectively, apart from urgent treatment, given over to dealing with COVID. So our margins of tolerance there are lower than they were last year. So all of this is a careful set of judgments we have to make. I do not want to go back to restrictions. I hope we can get through this with all of us behaving sensibly and appropriately. I think it's important to point out to people, because there is media coverage to the contrary today, and I'm not criticising the media for this. I am not looking at options right now for a circuit breaker lockdown. I said on Tuesday, if we did feel we had to introduce anything, we'd do that in as limited and as proportionate a way as possible. But the key message right now is all of us have a part to play. This is a virus that has upended our lives for the best part of 2 years now. But at its heart, and you've heard Jason in particular say this so many times, we know the basic things we can do to stop it transmitting. Delta is really infectious, but it is about face coverings. It's about just keeping a bit of distance from people. It's about washing your hands. It's about keeping rooms ventilated. If we all do that, we've got a chance of starting to slow this down again. And that is my appeal to everybody. None of us enjoy it. None of us want to still be doing this, but it is really important that we do.
I'll come to your events in a moment, Ewan, and it's nice to see you in person in the room. So there are 167 more people in hospital today than there were last Friday. So that would suggest harm is increasing. It's not increasing the way it increased in wave 1 or 2, but it is increasing. Deaths are tragically still happening, but are much less than they were in wave 1 and wave 2. So that would suggest, and we know from the evidence, that vaccination is moving people down that disease curve. So those who might have been very, very unwell and potentially die of this disease are now still ending up in hospital but surviving. And others who would have ended up in hospital are not needing to go into hospital. So harm has moved, but if you get 7,000 or 8,000 cases, harm is going to be there. And that's the real tricky balance. And that's why you hear us talking about all these mitigations. I'm never going to call something in the middle of a pandemic safe or unsafe. You might get me to say some things are unsafe. So events are neither safe nor unsafe, but they can be made safer. I think that's the middle ground between them. So I think it's right that they're going ahead in amongst the regulations and the guidance that we presently have. But if you're going, or you're the organisers, there are things you can do to make them safer. So if you're in charge of the Old Firm game, or if you're going to the Old Firm game, or you're watching the Old Firm game at your pal's house or in the pub, try and get vaccinated if you haven't already done that. Test before you go out, either to the stadia or the tube or the pub or your pals, and follow the guidance. And not just follow the guidance, extend the guidance a little bit for you personally. So even though we've removed the law for distancing and numbers, maybe just think about what that will be like if you're going into that environment. Keep your distance, wear your face covering a little bit more, even than the law would suggest you have to do. So they're not safe or unsafe, but you can definitely make them safer by your personal behaviour. And organisers are trying to do that, asking for tests on the way in, checking on people's status, all of those things. That's my advice for whether it's a music festival, an Old Firm game, or a night out with your family at the restaurant.
Just to amplify a point Jason made there, often with big events, understandably, we focus on the event itself, so a football match, people in a stadium, and it's really important that mitigations are observed there. But often somebody will be at greater risk when they're travelling too, because the stadium is outdoors, but the bus or the tube or the car that you're travelling in it poses more of a transmission risk. So it's really important that you're taking mitigations there as well. And the LFD test before you go, the face coverings en route there, the hygiene, all of that is really important. If you're watching the match in your own home, again, that poses risks that perhaps are different to the ones at the stadium. So keep the windows open, keep a bit of distance, don't have crowds of people in your own home. These are all things we fervently wish we weren't still having to say and ask people to do, but it's really important if we're to avoid going backwards in a way that none of us want to. Ben Phillip from BBC.
Thank you, First Minister. At the moment, more than a third of COVID cases in Scotland are detected in people under the age of 19, and the 12 to 15 age group is expected to be a surge there in the coming months, just with the schools going back from the summer break. should the JCVI consider extending the vaccine programme to vaccinate younger teenagers? And indeed, should the Scottish Government consider introducing vaccinations in schools to try and increase uptake among younger people?
Well, the latter part of the question, in terms of 16 and 17-year-olds and vulnerable young people under that age who are already eligible for vaccination, yes, we are considering the ways in which we can do that to get to as many people as possible. In terms of the question of should JCVI advice now go further to recommend vaccination for all 12 to 17-year-olds, it would not be right for me to certainly wouldn't be right for me to do it. It wouldn't even be right for me to sound as if I was trying to tell the JCVI what to do. They are the experts. I'm a politician, but one trying to take the best decisions to keep the country safe. I've said before, and I will say again today, I really hope that the JCVI feel that the evidence allows them very, very soon to recommend vaccination for all 12 to 17-year-olds. The Scottish schools go back earlier than schools elsewhere in the UK, and I would have ideally liked that to have been the case before our schools went back. But the sooner we get to that point, if the JCVI feel the evidence allows them to make that recommendation, I hope they do that quickly. I would simply point out, and again, the JCVI have to look at the advice. There are many countries across the world who are already vaccinating 12 to 17-year-olds. So clearly there are expert groups there who think this is safe to do. So I suppose if I was making a plea to the JCVI, it's not for me to tell them what decision to reach. They've got to do that on the basis of the evidence. But please make it quickly, because I would really like, assuming we've got advice saying it's safe to do, I would really like to go on with vaccinating 12 to 17-year-olds as quickly as we possibly can. Go ahead.
Only that we're ready for when that advice comes. The vaccination programme is ready to go. We'll vaccinate where it's appropriate to vaccinate. We'll communicate in a way that is appropriate for that age group. And actually, the 16 and 17-year-olds and the group just above them, they've come forward in big numbers really, really quickly. We haven't been open for long, and we've done tens of thousands of them.
Duncan Bick from ITV Border.
Thank you, First Minister. In southern Scotland, in Dumfries and Galloway, we have a very high rate of COVID infection. And in the Scottish Borders, the local hospital has had to take effects to restrict the number of visitors in because of the risk of asymptomatic transmission. Does the Scottish Government have any specific concerns about either area?
I think you can hear from both our tone today, but also you can see from the figures I've reported today. Of course, I have a concern about all parts of Scotland. There are variable, as has been the case throughout, variable rates in different areas, but the level of infection and transmission across the country just now is higher than any of us want it to be, and that includes the southern parts of the country. That is already having an impact on our health service because, as I said earlier on, the health service is not just dealing with COVID. It's not there to just deal with COVID. So there is also, we have in the health service, staff across primary and acute care who have been working flat out over the past 18 months, and they are tired, like the rest of us are fed up with this. They are also fed up with this, and they're being expected to continue to deal with COVID patients and start to catch up in the backlog. So this is really difficult for the health service. And health boards, individual hospitals at times will have to take difficult decisions they don't want to take. We've seen in the last few days pauses on elective procedures in some parts of the country. And as you said, they are in Borders, and I think there's another part of the country that have done similar today, restricting again, Glasgow, restricting again the visiting to hospital to essential visitors only, monitoring it on an ongoing basis. So these are decisions nobody wants to take, but I support health boards in taking the decisions they think are necessary to treat people and to deal with the most serious health impacts that they face. But all of us have to help the NHS here by trying to slow down transmission. So we come back to basics again, just do all these things that try to avoid this virus spreading. And that is the best thing any of us can do to help the NHS right now. Oliver Wright from Bauer.
Thank you. We're hearing from nurses who are close contacts, and they're being asked to self-isolate and not come into work, even though they've tested negative and are double vaccinated, because someone they live with has got COVID. Now, that seems to be different to the rules for everyone else. Why is it different when the NHS is under so much pressure already?
These decisions have to be taken carefully. We do have a different, less restrictive position on self-isolation right now. In fact, that was introduced for use by the NHS before it came into being for the general population. But judgments have to be made in order to limit transmission in hospitals, which will rise as transmission in the community rises. But I'll hand over to Jason, who might want to say a bit more about that.
It's a simple risk-based choice. We are looking at it again as 4 countries. Actually, the 4 countries' clinicians are looking at it again over the next few days. But fundamentally, we think the risk is higher for health and social care workers if they live with a household positive than it is for the general public, because of the job they do, not because of the life they lead. Therefore, we've made a choice in there that the risk margin is slightly higher for health and social care workers. So if you're a contact of a random positive, you don't need to isolate if you're doubly vaccinated and you've got a negative PCR. But if you're a contact of a household positive, you do still have to isolate. Now, we'll look at that again as time passes, but you can see from these high numbers, we're trying to balance, yes, the health service needs all the staff it can get, and yes, we want to limit transmission of the virus. Those two things kind of bounce off against each other a little bit, and we've got to make a judgment in the middle there somewhere. So it might change, but for now, that nurse is absolutely correct, and that's to protect patients and families in the health service.
First Minister, it's actually Caitlin Hutchison now from Global. I wondered, what would you say to people terrified at the prospect of going backwards, potentially reintroducing restrictions, but also to those who already feel they're back in lockdown because they're clinically vulnerable, feel incredibly unsafe with rising case numbers, and argue they should be called protections rather than restrictions?
I have massive sympathy for all of that, and I feel all of that. I wish more than anything I'm sure every person in my position across the world feels this, we could just wave a magic wand and make this all go away. We can't. It's an infectious virus. It's a global pandemic. We have to manage it as best we can. The position we maybe should call restrictions protections rather than restrictions, and that's a not unreasonable point to make. It doesn't change the fact that when you have restrictions, even if you call them protections, just like the virus, they do harm to people, because if they harm the economy, they harm people's jobs. If they are stopping people interacting with family or friends, they harm people's well-being because they increase isolation. So, if the restrictions / protections were harm-free, that would be a much easier calculation to make, but they're not. They do their own harm. So we have to try to balance that. We can take a more less restrictive approach right now because of the impact of vaccination, but we can't be complacent about this virus. And if you are particularly vulnerable, I can understand that you and your carers are feeling even more anxious than the general population right now, which is why the general population, as well as doing all of the things I'm asking people to do for their own sake, have to be mindful of doing it for the sake of people who are more vulnerable. None of this, is easy for anybody, and I really understand that. And I will try with my colleagues, with advisors, to take the most proportionate, legally we have to take proportionate decisions, but to take the decisions that are best overall to keep the country as a whole as safe as possible. I said in my opening remarks, not for any other reason than just to remind people that this is not a normal, situation that politicians deal with in normal times. It is not the job of a politician right now to be popular. It's the job of a leader to try to take the decisions they think are best. These are not easy decisions, but then we don't do these jobs because they're easy. So I will try to do that, but I absolutely recognise that this is, again, an anxious time for people. For those who would feel safer if we effectively were back in lockdown, I understand that, but for the reasons I've set out, that does a lot of harm as well. But I also understand the fear that people have of going back to restrictions, who've just, particularly young people, I think, who've just started to get a sense of normality back into their lives. So I understand all of that. And that's why my job, my responsibility, is to try to navigate the best path forward, and that's what we will try to do. Katrine Bussey from PA. Katrine, we can't hear you. Are you on mute?
We're nearly 2 years into this and I'm still not got the hang of
it
yet. I wanted to ask about schools today. You talked about how you would like the JCVI to come forward quickly with advice on vaccinating 12 to 17-year-olds. But Seamus Searson from the SSTA union was on the radio this morning talking about, yes, the need to vaccinate older children, but also saying that the need for mitigation such as face coverings could continue much longer than the 6 weeks the government indicated that these would be in place for when schools went back. And also really warning that the high number of cases could lead to teacher shortages and children having to be sent home because there weren't enough teachers to teach them. And I just wanted to get your response to that, please.
I mean, these are all perfectly legitimate and understandable questions. I suppose on the last part of that question, if we keep seeing the virus run out of control, all sorts of things may happen. We can see that across all sectors of society, but it brings me back to my central point. What we've got to do right now is operate, and all of us behave in a way that tries to stop that happening, that tries to limit transmission. We have to consider the implications of continued rises in transmission as we go through the next period, and that's what we will do. But the key message I want to get across right now is that if we all behave in line with the advice that people are being given, we have a chance of slowing transmission, and that's, I think, what we should be focusing on in the immediate term. I've covered the points about vaccination of 12 to 15-year-olds, so I won't repeat what I said earlier on about that. On the issue of face coverings, we think it is right, not easy for young people. I've got a niece and nephew in the age group affected by this, having to wear face coverings in classrooms. I know how horrible that is for young people. We don't want that to be a requirement for longer than necessary, but right now we think it is an essential mitigation. We said 6 weeks after the start of term, and we will review before we get to the end of 6 weeks. But I think most people would probably understand that if we continue to see transmission at fairly high levels, and that's a mitigation we may have to keep in place. But I promise young people we won't do it for longer than we think is absolutely necessary.
I heard that interview on Good Morning Scotland this morning, and I thought, I was going to say in the main, the whole of it was very sensible, actually. In his position, I would be giving very similar advice. And the most important thing he said is one of the things we said at the beginning. Don't just follow the law, because the law has now restricted itself to only a few things, but look to follow the best guidance you can for your environment, whether you're the head teacher, the parent, or the kid. So try and keep yourself and your institution as safe as it can be, even if that means moving a little bit beyond the law. So it might, he used the example of staggered entry and exit times for kids. That's not the law anymore, but if that makes sense for your school, in your context, with your limited street access, then that's what you should do. We're not telling you every single step you have to do, but keep it as safe as you can. I thought he made very sensible points.
Many people will say to me, and it's a phrase we hear a lot just now, we just have to learn to live with this. It's not a phrase I particularly like, because it sounds as if we're underplaying the potential risks to people of the virus. But if that is your view, living with an infectious virus is not just the same as living without an infectious virus. So all of these mitigations that we're talking about, that in normal times, people might do, wash their hands or might not, people wouldn't be wearing face coverings. Doing all of these things, if we are to live with it, is what we're going to need to do in order to make that possible. So it really is important that, although, because we can't keep legal restrictions in people's lives because it's not proportionate, so we can't do that forever legally, but it is still incumbent on all of us to think about what we do when we've got an infectious virus circulating to minimise and mitigate those risks. So there is still a big burden on all of us to do that. Gina Davison from the Scotsman.
Hi, First Minister, thanks. Just kind of going back to Caitlin's question about vulnerable people, Can I ask if you can give us an update on what's happening with the booster jags that are expected to start in September for people in vulnerable categories, because that's next week, I guess. I just wondered if letters had started to go out.
We don't yet have final JCVI advice on that. We're expecting it any day now, and again, a bit like my plea to them earlier on, sooner rather than later, but we are preparing for it. So we have all of the arrangements in place to get going with that. You will recall the interim advice from the JCVI gave the order of priority for booster jags. So that's the basis on which we've been planning.
Yeah, they just haven't fired the starting pistol. They told us to get ready, but they needed to look globally at countries that vaccinated fast, us included, Israel, Chile, a number of others, to decide when is the sweet spot for injection number 3. That's the exam question they're answering. They haven't quite answered that yet, but my understanding is they will imminently. But we're ready as soon as they do.
Daniel Sanderson from the Telegraph.
Thanks very much, First Minister. The public were told that vaccination was the sort of route back to normality, and as you said at the start, people have been vaccinated in huge numbers, but we're still seeing these record number of cases, talk of restrictions, people being told to alter their behaviour. So I guess the question is, what's the sort of end game? What's the route out of this? What more can happen, or are we basically going to see these cycles of rising cases and people being asked to adjust their behaviour indefinitely? Thanks.
I don't know the answer to that question definitively, Daniel. If I did, I'm sure I would be much in demand across the entire world. We've tried to be straight with people all along. Vaccines have introduced much more normality. There are very few legal restrictions on our lives now, and that is good. I remember standing here many, many times making the point that, while we were confident vaccine was going to reduce the chances of people becoming seriously ill, and we see that that is very much the case, there was less certainty about the impact of vaccines on transmission. And again, particularly with Delta, vaccines will reduce your chance of getting the virus, but it will not eliminate your chance of getting the virus. The biggest impact is when you do get the virus, it will reduce your chance of becoming seriously ill. So, vaccines they're not perfect. They're not 100% effective. They're not, a magic wand in the sense that they stop anybody getting this. But my goodness, they have delivered so much benefit to us. And, it is unthinkable the position we'd be in right now if we didn't have vaccination. But this virus is still circulating. It's still circulating here. It's still circulating in most of the rest of the world. It's mutating. So we can't say for sure right now, here's a date in the future when I won't be saying to people, wear a face covering in some respects, or even more likely, wash your hands, ventilate rooms. I hope that we get to that point soon. But even if in Scotland we got to that point, we have to be mindful this is a virus that may still be circulating in the rest of the world. Some of what I'm asking people to do right now is tiresome and tedious and really, really difficult for people. But asking people now to wash their hands, to wear face coverings, is not the same as asking people to have nobody in their house for long periods of time. So we have made progress, but we still face this horrible infectious virus, and we need to be mindful that we have to operate in a way that stops it as far as is possible in its tracks, because it's going to continue to try to infect as many people as possible.
We don't know the answer to your question yet, Daniel. I'm afraid that the WHO doesn't know the answer. New South Wales has just locked down again till the end of September. New Zealand has just locked down again. No country in the world knows how to deal definitively with the ups and downs of the virus. And the difference between the first time when we said vaccines will get us out of this is Delta. Vaccines and immunity will get us out of it, but that journey is now much harder because of Delta, which is why we need the public's help to get those vaccination numbers up higher. We probably need boosters. We probably need people to keep isolating when they have symptoms for longer than we would have hoped. All of those things together will get us out of it, but it's a harder journey than it was with wild type virus or alpha virus.
Good afternoon. Just want to check, what are the chances now of you bringing in vaccine passports for certain events or venues? Because the Scottish Government has obviously been quite down on the idea so far, but with this surge and universities due to return in a few weeks, is it something you're increasingly considering? And separately, you said that Scotland needs a referendum for recovery from the COVID crisis. You'll probably be aware that the Scottish Secretary said today that he would acknowledge that there was a desire for a referendum if he consistently saw 60% of the population wanting a referendum. This is presumably via polls. Just want to check, does this sound fair enough to you?
No, I'm not going to get diverted in a COVID briefing into responding to the Secretary of State. I think it was the Secretary of State making up constitutional rules as he goes along. We have constitutional rules that are pretty well established in a democracy, is that if a party wins the election on a particular proposition, they should get to implement that proposition. But I'll leave that to one side right now. On your COVID question, which is a very good and important question around vaccine status certification or COVID status certification, because certification can include testing as well as vaccine. We are actively considering. I've tried not to be up or down on the question. I've tried to be, reasonably open-minded. There are, and I think all countries would recognise this, there are ethical equity considerations. There are also practical considerations. We've just been talking about how Delta, in particular with Delta, vaccines don't completely stop transmission. So there are practical questions about how much protection in settings against transmission that would give. But we are actively considering. I don't think be in favour of vaccine certificates for access to essential services that people don't have a choice over, but places where it's optional, we all have a choice whether we go to. It may be an added layer of protection and mitigation, not a silver bullet, but an added layer that will be worth considering. So literally, we are actively considering that. I think the last time Parliament met over the summer virtually, that of course we will make sure we fully involve Parliament in any of those decisions because of the ethical issues around them. But I've been clear all along that we shouldn't rule it out. The app that we will shortly launch, which has been designed principally to ease the process of vaccine certificates for international travel. As I've said before, it does have functionality for use in domestic settings. So it's certainly not something by any stretch we have ruled out. We're actively considering it.
Can I just check this? You mentioned optional places there. Just for clarity, for a point of clarity, when you say optional places, do you mean nightclubs, pubs, that kind of thing?
I think that probably would be comments. I'm trying not to single out particular settings because I don't think it's fair, because that could extend to a lot, and we've not come to a point, this setting not that setting, apart from what I've said about not favouring it for access to essential services. So yes, what the kind of places you're talking about, of course, would come into these categories, but I don't think it's fair just to single out. Nightclubs have had a particularly torrid time. They've been closed longer than any other setting. So yes, they are included, obviously, in that kind of category of optional places that people can go, but I don't want to particularly single them out. Rebecca Monroe from Broadcasting Scotland.
Good afternoon, First Minister. So given the rise in cases we're seeing since moving beyond level 0, how do you feel the young people are responding to the vaccine take-up, and how well do you think that guidelines are being followed, partly because the weather's been so sunny and anomalies to kind of occur, such as students not being in lectures but they can go out clubbing?
Thanks, Rebecca. Can I just say my apologies to Michael Blackley from the Daily Mail. I've inadvertently, I promise it was inadvertent, missed you. I'll come back to you after I've answered Rebecca's question. I turned my sheet over before I should have done. Rebecca, on the uptake of vaccine amongst young people, it's very, very good. I mean, we've only been vaccinating 16 and 17-year-olds for a matter of weeks, and already almost half have come forward and got the vaccine. Now, we want more to do that, and we'll continue to encourage, but also look at how we make it easier for young people. But the uptake has been good, but we want it to be better. We talk about percentages, and the percentage uptake across all age groups is good, much higher than I might have dared hope for at the start of this programme. But even although you might have a small percentage that are not vaccinated in any particular cohort, that will be quite a large number of people. And literally every person that doesn't have the protection of vaccine who could get it is a vulnerability to themselves, but also a vulnerability to people around them, because they are more likely to get the virus and therefore more likely to pass it to others and more likely to become seriously ill. So more likely to be one of the people who end up admitted to hospital. So, you know, I keep saying this, and I will keep saying it because it is so true. The single most important thing any of us can do is get vaccinated. So please, if you haven't done it already, make sure you do. Young people, you know, I think young people have everybody's had a raw deal in the last 18 months. Young people in particular missing key moments in their lives, missing, you know, the ability to socialize normally with their friends, the things that we all took for granted when we were growing up. So it's really good to see young people get the opportunity back to do that. But we need to continue to encourage care and caution amongst young people, just as amongst the general population. So stay outdoors. I took part last night in a lovely event, an Edinburgh University outdoor graduation around Edinburgh Castle, you know, including people who graduated last year who weren't able to do it. So stay outdoors as much as possible. Follow the mitigations when you're indoors and just keep yourselves safe. It would be my advice to you at the moment. And sorry, Michael.
Hello, thank you for coming back to me. I wouldn't want the need to introduce restrictions. Could they be a restriction in themselves? And also in terms of the Scottish Government has today published some projections that show quite a big rise in case numbers and hospitalisation potentially in the next few weeks. A better case scenario being 1,500 hospital beds, a worst case scenario 2,500 hospital beds. If that comes to pass, does that require action if that comes to pass in the coming weeks? And there's no projection this week on estimated deaths. Is there any reason that is not provided? And would it really need to be a big rise in ICU and deaths for action to be required?
Forgive me, I'm not sure why there's no projection for
I think
deaths.
it's just getting harder to do with the lower numbers, but
I'll double check whether there's any other reason behind that. What we do know, thankfully, and I really mean that, thankfully, while as Jason rightly said earlier on, any death is a tragedy, but deaths are at a much, much lower level than was the case previously. And they are the indicator here that are rising most slowly, which is good. And we want that to continue to be the case. On your other questions, look, the projections for hospital cases in ICU are a worry for us. I mean, at an earlier stage of the pandemic, in the last peak, January this year, there were more than 2,000 patients in hospital. At the previous peak in April, 1,500. So we know that these levels can be reached. The difference now, and I'm afraid it's a difference that ups our concern rather than lessens our concern, is that the health service, unlike certainly in April last year, when we cleared it pretty much of all other non-urgent care, that's not the case right now. We're trying to catch up with urgent care. So the margin there is much narrower, which is why we need to be very, very mindful, apart from the impact on individuals, very mindful of that rise in hospital admissions. But we don't want to go back to restrictions if we can possibly avoid doing that. So we'll be monitoring this very carefully. And remember, on all of this, none of us are powerless. So if you're out and about this weekend, every time you wear your face covering, wash your hands, test yourself before you go out, you're playing your part, assuming you're already vaccinated, you're playing your part in helping us to not get to some of these numbers. And on vaccine certification, again, I don't want to oversimplify this. I tried to set out to Chris earlier on, you know, I'm open-minded to anything that helps us get out of this. But apart from vaccines, the closest we've got to some kind of silver bullet. And against Delta, even it's not an absolute silver bullet. Nothing else on its own is going to do that. It's a combination of what we can do. But if vaccine certification can play a part in that, then yes, I suppose theoretically that might give us an added layer of protection that way that might make it less necessary to introduce a protection somewhere else. So that's the kind of overall balanced approach that we're trying to take. And I think that concludes. No, I'm told. Yeah, no, I've been getting a message that sadly GB News haven't been able to join us today as we were anticipating they would. So that does conclude the questions today. Thanks to all the journalists, to Jason, Yvonne for our BSL interpretation, and to those who've joined us today. Thank you. I know the news today is not what any of us want to hear, but don't lose sight of the fact the vaccines are still providing us with a lot of protection.